A warm welcome to all our viewers to our series Natural Medicine. I picked a topic today because I think there's still a lot of confusion. It's about the so-called gluten and the related gluten addiction and the effects of gluten within our gut. What contains gluten anyway, and why? And why should we be very cautious about it? That's the topic of this show, which I'd like to discuss with an outstanding doctor. So please stay tuned, we'll start right away. Here we are again. Now, may I introduce you to my guest? It's none other than Professor Dr. Thomas Rau. Welcome, dear Thomas. Yeah, thank you very much for allowing me to speak here on this station at all. And let's see what questions you have. Yeah, well, let's start with gluten. What contains gluten? And why is gluten a big problem in our intestines? Gluten is very well known in the so-called organic scene. Unfortunately, people still don't know enough about gluten. And that's the way it is. Gluten, or gliadin, which is the same thing. Some say gluten, others say gliadin. And this is a protein that's found in many types of grain, and to which very, very many people are sensitive. You can have an allergy, but you can also have an actual chemical allergy, chemical sensitivity to it. And accordingly, it's incredibly broad. Gluten is contained, or gliadin, this protein, is contained in cereals, especially wheat. And the great property of grain, wheat, or flour, is that it binds water, and then the bread turns out so fantastic. You can literally smell the gluten-containing bread. And this has this dampness and is still good in 3 days. So machine-made breads can be prepared simply. Only have to be baked, and still they can be kept for several days afterwards. And for this reason, so that one can industrialize bread or grain products, can mechanize, can manufacture in a much broader way. The wheat was bred and developed to contain more gluten. And whether it's genetically engineered or not, you can also cross wheat in other ways so that they can then always contain more gluten. But that's one thing. Today's bread simply contains a lot more gluten than 20 years ago, or when I was a boy. That was a bit longer ago. And then the other thing is that gluten is even added to a lot of foods to keep them fresh for longer, or also to be able to bind the water better. Gluten binds the water, binds also the water in the body, and that makes the big problems afterwards. Gluten is a relatively small molecule. I don't know exactly what the molecular size is. It's a relatively small molecule. And now comes the second topic that we should also deal with. In the same go, we have the leaky gut. And that's when the gut is no longer intact, and that's very, very common these days, with my patients at least, but also among people generally. Then these gluten molecules go through and become recognized as alien inside, and there's an immune response to that. So, gluten comes in incredibly frequent numbers. It's expressed as a problem in terms of health, and it's then unfortunately not recognized because it has a lot of effects, such as allergies. but completely different allergies. You can then have hay fever, you can have sensitive skin and so on, or it's neurological. And the most common thing I see is gluten sensitivity or gluten issues in rheumatism, in joint patients. I think we'll get into that in a moment, but I keep getting voices saying, I know all this, I don't eat white bread, I eat whole grain bread. Yeah, unfortunately, the whole grain bread also contains gluten. All grains, all gluten-containing grains have gluten. And I even think it's even worse when you're using multigrain bread. People get the impression it's so good. No, then it even has different allergens in it. All grains containing gluten are problematic. Apart from, well, I just have to list it. Millet, quinoa, amaranth and buckwheat have no gluten. So only with these, gluten-free bread is possible. That's stupid. However, these breads are more difficult to make. They age faster and they're drier. Exactly what we don't want. And that's why these breads aren't that popular. Millet bread, amaranth, quinoa just aren't part of our food culture. Well, my wife also makes bread, and I have to say she makes it without wheat, without flour. So if you take a little time, it's really delicious. And in Switzerland, there are two big shopping chains, and one of them, without mentioning the name, it now makes such a cube bread without flour, and it's great. I love this bread, it's fantastic. So there is a trend away from that. We're just talking about bread now, but we also have gluten in pasta and pizza. I completely forgot about that, yeah. So I'm not prepared for that today. I work from the gut. Yeah, there's really a lot in the stomach. Well, all wheat products, that's the pasta, these are the pizzas, anything made from grain contains gluten. And there are also excellent products that are gluten-free. But you really have to look for them and carry the awareness with you. I recommend, anyway, this also applies to cow's milk problems, that you should always check the products in the department stores, in the shops. What is inside? Does it contain gluten? And it says gluten. Yeah, or just wheat flour or something. But it is written, as well as milk powder is written, that it's in it. Okay, well, now I always have people saying pasta again. I have spelt pasta or whole grain pasta, but in the end there's always flour in it. It always has gluten in it, even if they think they have better grain. But now, let's jump back again. From the evolution, it was a quantum leap for mankind to farm and to sow corn. And they all became old too. Was this grain simply much less gluten-containing than it has become in the last 20 years? Exactly. So, first, wheat consumption has increased. Since 1980, the grain consumption has increased several times. I think about eightfold in our Western diet. That's the first thing. Secondly, within the wheat flour, so within the wheat, the gluten content increased by about threefold. The average consumer who eats our normal Central European home cooking, which contains bread and pasta and such, has today at least 10 times more gluten than our grandparents had in 1960 or 1950. And this has increased massively, so that products could also be manufactured industrially. And people just like it so much, you almost get addicted to it. We can get to that later. And another thing, if I can just add it, a little misconception I just hear every day: spelt is so healthy. It's just not true today. Spelt is also cultivated. Practically no spelt is original spelt that would then have less gluten like 50 years ago. But it is written, original spelt. Yeah, it's there is original spelt. But the need will actually never be covered with this original spelt, that it does not grow well. Production's very low anyway. Most of the spelt varieties have also been bred again, just developed upwards. Well, spelt contains gluten. So if you're sensitive to gluten, you shouldn't eat spelt either. It contains less gluten than wheat, but also it's important to know. And before we get into the effects of gluten, again and again I hear gluten is also addictive. Why do we feel addicted, like being a junkie, when we binge on gluten? Well, dear viewers, now it's getting complicated. So, why is gluten addictive? Because many people not only have gluten sensitivity, but also a leaky gut. And the intestines have been damaged over the years by the miserable food that we unfortunately eat. And by taking antibiotics, the gut bacteria, which are supposed to protect the mucosa, were also reduced. It's multifactorial, multiple factors are behind it. So now this gluten comes to the sensitive and already qualitatively reduced intestinal mucosa. It's all about the small intestine, where the gluten or just the food should be absorbed. And then the grain molecule, so the gluten molecule, comes in and it's recognized as alien. Now, the person who has such an intestinal mucosa, and 80% of the people today have it, a reduced quality of intestinal mucosa, just quality, and then the gluten comes in touch with the mast cells, which are on the lung side, on the inside of the intestines. They degranulate. And there is a mast cell degranulation phenomenon, a histamine release. Histamine, that really gives the kick. And then it becomes addictive. It's just stupid that it also leads to a reduction in immunity over time. And these people, they then take a large amount because they feel so good after eating grain, pasta or something, bread, well, then they feel good. And that's an hour, 2 hours, then the histamine drops again, and then you think, I should eat something again. People then come to me and say, I watch what I eat and I'm not losing weight, and I just have to eat. It's that histamine-gluten cycle. So when it comes to gluten, people always say it's sticky. And someone once told me that there really is a layer of gluten in the small intestine, and the body is always trying to scrape it off. And then it just gets sore too, because it keeps wanting to scrape off that gluten which sticks there, which doesn't belong there. And then the gut opens up and all sorts of substances ultimately get into the bloodstream and trigger immunological reactions. And that's something I'd like to know about you in your clinic. How many patients in 10 are affected, that they already have a leaky intestine? In our Sonnenberg Clinic in Schwelbrunn, we do grain tests. We do food allergy tests, which unfortunately are not made by the gastroenterologists, or only very little. And in over 80% of all people, we find hypersensitivity. Now, I'm not saying a full allergy, but a hypersensitivity. Now, the most common, briefly another topic, is cow's milk protein. This is even more common than the gluten. For example, again with our patients who come to us, unfortunately we not only have healthy people, but they come because they have unclear illnesses, because nobody knows what to do with them. More than 80% have hypersensitivity. And cancer patients, now I have to hold onto my chair, more than 90% of cancer patients have food sensitivities and have assisted to destroy their small intestine mucosa, just like you said, for a long time. And then it becomes inferior and only becomes more sensitive through the long time. Grain allergies, but also cow's milk allergies, we find, to your question, in about 80% of patients. But they usually, or very often, don't come because of intestinal problems. They come because of joint problems or because of cancer. Well, severe chronic illnesses are often related to this nutritional problem, cow's milk and wheat products. Yeah. I always ask myself, why? And then I hear an argument that I keep hearing about. If that were the case, every Italian who constantly eats pizza and pasta would actually only be seriously and chronically ill. And well, that's a good argument. And when I think about it, are they all somehow chronically ill? Through the gut, do they have that leaky gut yet? Are they open to immunological reactions, or do they have a better processing grain? Yeah, I think it's all factors a little bit. So what you might ask is, how about the Chinese or Far Eastern people who eat rice and just not grain, or much less grain? They actually have a lower average gluten content. Italians or Germans or French, it doesn't really matter at all. First, nutrition has become so, well, how shall I put it, westernized. Well, so the diet is practically no longer that different. Whether you're here, the Germans just eat more bread, the Italians just eat maybe more pizza and pasta. But overall, the use of grain and flour has increased massively in recent years, and all across the Western world, including the USA, where it says it's even very, very bad. So would you say that there aren't any people nowadays who can tolerate bread, this pasta, these gluten-containing products still today? Well, that's not entirely true. It's not advisable for all people because gluten is an irritant per se, but there are people who can take it a little better. And are those the ones that have good healthy gut? Yeah, exactly, it's all about a healthy intestine. But if you start as a child, and the average Swiss child, so a school child gets antibiotics 4 times a year. It's hard to believe. Anti against bios life. So it's just consistent. In our medical average supply, the intestines are simply incredibly damaged. And it's not about the intestines, the mucous membrane. No, the damage caused by the antibiotics comes from the intestinal flora, the gut bacteria that make the inside like a lining and protect the gut. Can we maybe look at that a bit more philosophically? If we now know that gluten can destroy a great deal in the body, so that many autoimmune diseases and so on can occur through this perforated intestine. Wouldn't we actually have to see that these foodstuffs are banned or at least drastically reduced? I'm talking about collective public health, which we should all focus on a bit, that also reduces the number of hospital beds. People stay healthy longer and so on. A government order would have to be issued here, or educational campaigns would have to be run. I would very much support educational campaigns. As a liberal-thinking person, I am against government orders. I don't think that the government should decide about our health. I'm with you, only that it seems to have changed today. That today non-medical people know exactly what is good for the people. And that's why I'm bringing this philosophical question into play in a slightly provocative way. You have to be very specific here, right? Theoretically. Okay, if we really want to look at it philosophically, then I have to say that we were given a life, and I am responsible for this life myself. And every human, and the more this responsibility is relieved of them, the more they lose humanness. And this is something very, very important to me. You have to inform yourself. You have to take responsibility yourself. But when do you do that? How do you do that? No, when? You always do it when you're in pain. Well, exactly. That's why here at the Sonnenberg Clinic in Schwelbrunn, we just have people, thank God, and there are more and more of them who want us to show them what they can do themselves, to take responsibility themselves again. And that's what medicine needs. And it's interesting that the vitality, if we now go really philosophically behind it, the vitality that we have received lies in that there's no organ that regenerates cells faster, that contains more vitality than the intestine, and even more intensively the intestinal bacteria, with whom we live together and constantly have a symbiosis. And this is where our life force lies. It's also interesting that the intestines have a temperature about 2 degrees higher than the rest of the body. Have you ever wondered where our oven is? We have 37 degrees Celsius or 36, but where is that coming from actually? Well, it's the intestines, and this is where temperature is generated. And then it goes, saturating the whole body with this energy. And when we have a destroyed gut from this horrible diet, these days, this prepackaged diet with preservatives, preservation, that no bacteria can get in there. The bacteria are the most important thing. We get antibiotics, which destroys our intestines over the long term. And then 20 years later, people come with gliadin sensitivity, with rheumatism, because they have the gluten in their bodies and it irritates there and then causes inflammation. Gluten is pro-inflammatory. Well, thank you very much, dear Thomas. That was very instructive and important to hear, especially now with the bacteria. So what if we eat preservatives, eat foods with preservatives? What happens down in the gut? Are the bacteria also preserved down there? Do they die if I eat that? I mean, that's a question I just so naively throw out there. Well, you have to get this awareness. Preservatives are added so that the food products are firstly non-bacterial, these are then the antibacterial preservatives, but also that they do not enter into any chemical processes. Then the meat stays nice and red longer if you add sulfites. or if you add antibiotic substances, chemical substances, so that they don't react with bacteria. Yeah, now you have a cold cut. How do you say cold cuts? Yeah, cold cuts, sliced cold meat. Yeah, no, well, that lasts 14 days. Well, that's not normal. You can only do that if you preserve it. However, important substances are destroyed during this preservation. And in the intestines, these substances will also have a preservative effect, and the bacteria die. So you have to get the stuff fresh from the butcher. Yeah, if it has to be meat at all. We advise eating as little meat as possible, but that's another topic. But the preservatives are in most of the finished products today that you just buy in the store. I think most people aren't that keen on health until they're 40 or 45. And then at some point it starts to pinch, and then you start to take care of yourself. Topics instead of actually bringing such important topics to school. What actually annoys me much more is it's just that the food industry expects us to eat such things. And that's that it's just being done. And we junkies love to eat it too because we get addicted to it. And maybe then eat 2 rolls or eat 3 rolls instead of just 1. And somehow it's all just so sad. Yeah, exactly. Well, let's leave it at that. That was Professor Dr. Thomas Rau, and for you, dear viewers, just to get an outline of what can happen when we eat too much gluten, and that this adhesive protein no longer has use requirements or has to meet completely different requirements than it used to. We heard that very clearly today. There's much more in it because much more has to be machined. And most people react to it. Not everyone, a good intestine can tolerate it, but many just can't. And then the consequence of this is that very many serious illnesses, chronic illnesses, can happen. And inflammatory processes in the body are promoted. We heard all that today. And we should all avoid that by simply massively reducing this consumption. And I wish you that, with all my heart. Do look for alternatives. There are some that taste great. All the best. See you next time. Bye-bye.